Hello everyone, my name is Chinedu Ude and I'll be debating on the topic: should African nations prioritize funding for research into population specific genetic diseases over investing in global collaborative genetic research? My team member is Dr. Nkiruka Ogidi and we are on the affirmative side. Now, in the context of advancing healthcare and addressing public health challenges, the debate over whether African nations should prioritize funding for research into population-specific genetic diseases versus investing in global collaborative genetic research is critical. And this discussion is particularly relevant given the unique genetic diversity and specific health challenges faced by African populations. Now, investing in research focused on population-specific genetic diseases is essential for African nations to improve health outcomes, enhance healthcare systems, and foster sustainable development. Now, while global collaboration in genetic research has its merits, prioritizing local research can lead to targeted solutions that address the specific needs of African communities. Now, we all know that the primary objective of research is to contribute to generalizable knowledge. However, most genome-wide association studies have predominantly focused on populations from Europe and Asia. And as a result of this, inferences regarding disease risks and protection in African populations may be unreliable due to genetic distances and the significant phenotypic and genetic diversity present within Africa. Now, in terms of addressing unique health challenges, African populations experience a distinct set of genetic diseases that are often underrepresented in global research efforts. African populations possess the highest level of genetic diversity globally, which is crucial for understanding disease susceptibility and treatment responses. The African Genome Variation Project has shown that this diversity complicates the identification of genetic associations with diseases when using data primarily from non-African populations. Now, by focusing on local genetic research, African nations can uncover genetic variants associated with diseases prevalent in their populations, such as malaria, sickle cell disease, certain types of thalassemia, and various hereditary conditions which may not be well represented in global studies. Also, in terms of enhancing local expertise and capacity, focusing on population-specific research helps build local scientific expertise and infrastructure. By investing in training and resources for local researchers, African nations can develop a self-sustaining research ecosystem that will empower scientists to tackle regional health issues effectively. Also, targeted research can lead to significant improvements in health outcomes. For instance, understanding the genetic basis of disease prevalence in specific populations allow for the development of personalized medicine strategies, which can enhance treatment efficacy and reduce healthcare costs over time. Also, in terms of economic benefits, investing in local research can stimulate economic growth by creating jobs in the biotech sector and attracting international partnerships and funding. Now, this investment can also lead to innovations that could be commercialized, benefiting both local economies and global markets. Now, when we talk about the ethical considerations, global collaborative research often raises ethical concerns regarding data ownership and benefit sharing. Now, by prioritizing local research, African nations can ensure that the benefits derived from genetic studies are equitably distributed among their populations, fostering trust and collaboration within communities. Now, in terms of aligning with global health initiatives, while global collaboration is important, it should not overshadow local priorities. The World Health Organization emphasizes the need for equitable access to genomic technologies tailored to local context. By focusing on population-specific diseases, African nations can align their efforts with these global health initiatives while addressing unique challenges. The missing gap in healthcare, especially as it relates to genetic risk and susceptibility of diseases endemic to Nigeria, needs to be addressed. Now, I would like to use the sickle cell disease as a case study. Now, the ongoing challenge of sickle cell disease, which is a major health crisis in Africa, highlights the urgent need for population-specific genetic research. Sickle cell disease caused by a mutation in the beta globin gene disproportionately affects individuals in sub-Saharan Africa, where it accounts for a significant public health burden, with over 70% cases occurring on the continent. Alarmingly, despite its prevalence, most advancements in understanding and managing sickle cell disease have been based on studies conducted outside Africa, leaving local patients without effective and relevant treatment options. Now, even the World Health Organization has identified sickle cell disease as a major health concern, advocating for systematic research to unravel the disease epidemiology and inform targeted interventions that address local challenges such as co-infections with malaria. Now, prioritizing funding for population-specific research not only addresses health disparities, but builds local capacity and can lead to economic benefits by reducing healthcare costs associated with sickle cell disease complications. Now, in conclusion, prioritizing funding for research into population-specific genetic diseases over investing in global collaborative genetic research would play a major role in filling the missing gaps in Africa's healthcare. Areas such as predicting accurately individual variability in exposure to risk factors, how this affects health outcomes, and formulation of policies as regards early screening and testing for susceptibility to chronic diseases would be addressed. This approach not only addresses the unique health challenges faced by the African population, but also fosters local expertise. It also improves health outcomes and stimulates economic growth. And finally, it ensures ethical considerations are met. By investing in targeted research, African nations can pave the way for a healthier future that reflects their specific needs and aspirations. Thank you.